Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Trigeminal neuralgia. Introduction.
Trigeminal neuralgia can cause severe pain or a burning, tingling, or numb feeling in your face.
Its treatment mostly involves the usage of oral medications.
If medications are not successful in controlling the pain, surgery may be needed. This program will help you better understand this disease, along with the benefits and risks of the various treatments.
Anatomy. The trigeminal nerve is the nerve responsible for most of the sensation in the face. There is a nerve on the right side and another one on the left side. The main part of the nerve, or ganglion, is located at the base of the brain, deep inside the skull. From there, it divides into 3 branches.
The first division, known as V1, provides feeling to the eye, upper eyelid, and forehead. The second division, known as V2, provides feeling to the cheek, lower eyelid, nostril, upper lip, and gum. The third division, known as V3, provides feeling to the area of the jaw, the lower lip, and gum.
V3 also controls some of the muscles responsible for chewing. Symptoms and their causes. Trigeminal neuralgia is characterized by severe pain in the face. The pain lasts for a few seconds and can spread to the rest of the face. However, it is usually limited to one division of the trigeminal nerve. Between bouts of severe pain, the patient is usually pain-free. Specific sites in the patient's face, such as the corner of the mouth, gum, or lip, can act as a trigger point. The pain can be set off when one of these sites is touched.
The pain can be so severe that the patient may refrain from eating or speaking for fear of triggering the pain.
It is still not clear what causes this pain. Trigeminal neuralgia is most often thought to be caused by abnormal compression of the ganglion of the trigeminal nerve by a normal blood vessel that has become more rigid because of advanced age. Other reasons for trigeminal neuralgia include tumors, multiple sclerosis, and abnormal blood vessels. However, these are very rare.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Medical treatment. Medications taken by mouth usually take care of the symptoms of trigeminal neuralgia.
These include medications usually taken for seizures. Other medications used to help patients relax their muscles could be tried.
If these medications used alone or in combination fail to reduce pain or are not tolerated by the patient because of their side effects, an operation may be needed. Surgical options and procedures. There are many surgical options. The best option depends on the patient's age, medical condition, and expectations. With the help of the surgeon, the patient decides which option is best suited for him or her.
This section covers the most common surgical treatment options, including alcohol or glycerol injections, radiofrequency rhizotomy, also known as RF lesion, balloon compression, microvascular decompression, gamma knife radiation therapy.
Some surgical interventions aim at destroying the part of the nerve causing the pain. These are known as ablative surgeries. Other interventions aim at taking the pressure off the ganglion. These are known as decompressive surgeries. Ablative surgeries could be done under local or general anesthesia.
The nerve sending the pain can be cut as it exits the skull before it reaches the skin. This is usually done through a small skin incision. Alternatively, alcohol or glycerol could be injected into the nerve to damage it. This results in complete numbness in the part of the face supplied by the nerve that was either cut or injected. When the nerve is cut, the numbness is permanent. The numbness after an injection could be permanent or temporary.
For example, if the nerve over the eye is cut, the center of the forehead will be numb. If the nerve under the eye is cut, the upper cheek becomes numb. Some patients cannot tolerate this numb feeling. Before the operation, the surgeon may be able to inject the nerve with a numbing medication such as Novocaine. This numbness usually lasts for a short time, but could help the patient decide whether he or she could tolerate the loss of sensation. Other ablative procedures aim at injuring part of the ganglion using either electric current known as radiofrequency rhizotomy or compression of the ganglion by a balloon. The radiofrequency rhizotomy, also known as RF lesion, is usually done under local anesthesia, whereas the balloon compression is done under general anesthesia. Using X-ray control, also known as fluoroscopy, a surgeon places a long needle through the cheek all the way to the base of the brain and through a small opening in the skull to reach the ganglion. If the balloon compression operation is used, the surgeon inflates a balloon to compress the ganglion while the patient is asleep. If the RF lesion is chosen instead, the nerve is stimulated with a small electric current to see which part of the nerve is close to the needle. This is usually not painful. It helps the surgeon move the needle until he or she is satisfied with its placement.
The patient is put to sleep briefly while the lesion is performed. The patient is then allowed to wake up and is tested for loss of feeling to make sure the patient has lost sensation in the targeted area. More than one lesion may need to be done before taking the needle out. Besides ablative procedures, the other option is a decompressive operation that aims at preserving the ability to feel affected parts of the face while taking the pain away. This operation is known as microvascular decompression.
This is a more involved operation that is done under general anesthesia. The hair on the back part of the head is clipped and the skin and skull are opened.
Using a microscope, the surgeon is able to see the nerve as it leaves the brainstem. There is usually a blood vessel pressing on the nerve. The blood vessel is then moved slightly and a piece of material is placed between it and the nerve to prevent further pressure or compression.
In the unlikely case where no blood vessel is found compressing the nerve, the surgeon may go ahead and cut a part of the nerve to relieve the pain. Numbness will result if the nerve is partially cut. However, this is not likely to happen, and it is important to discuss this option before surgery. The skin is then closed and the patient is allowed to wake up.
Radiation therapy is another option that has been used to burn a small section of the trigeminal nerve. This radiation is usually delivered using a special radiation source known as gamma knife.
Risks and complications.
These procedures are safe. There are, however, several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications vary from procedure to procedure. The more involved the operation, the higher the risks and potential complications.
The risks and complications include those related to anesthesia and those related to any type of surgery.
Balloon compression and microvascular decompression procedures are always done under general anesthesia. Risks related to general anesthesia include, but are not limited to, heart attacks, strokes, kidney failure, pneumonia, and blood clots in the legs. These risks will be discussed with you in greater detail by your anesthesiologist or nurse anesthetist. Blood clots in the legs can occur. These usually show up a few days after surgery. They cause the leg to swell and hurt a lot.
These blood clots can be dislodged from the legs and go to the lungs, where they will cause shortness of breath, chest pain, and possibly even death. Sometimes the shortness of breath can happen without warning.
It is therefore extremely important to let your healthcare providers know if any of these symptoms occur.
Getting out of bed shortly after surgery may help decrease the risk of blood clots. Some of the risks are seen in any type of surgery. These include infection, deep or at the skin level. Infections can involve the face or scalp incision. Deep infections may involve the brain or the fluid that circulates around the brain. This is known as meningitis. Treating deep infections may require long-term antibiotics and possibly surgery. Bleeding either during or after the operation. This may require a blood transfusion. Skin scars. Other risks and complications are related specifically to these procedures. These again are very rare, however, it is important to know about them. There is always the possibility that the chosen procedure may not help the pain. The procedure may have to be repeated or a different one may have to be done.
Rarely, the loss of sensation can involve the eye itself. In this case, the eye may get injured, leading to damage of the cornea, the clear coating of the eye. This is known as a corneal abrasion. This rarely may lead to permanent vision problems and blindness. The chewing muscles on the side of the operation may become weaker and cause some pain and difficulty chewing. This is usually very well tolerated by patients. In the case of facial numbness, a condition known as anesthesia dolorosa can occur. In this condition, pain may persist in spite of the numbness. This may lead the patient to keep on touching and scratching the involved area in the face, leading to skin damage and scarring. Because of this and because of the loss of sensation, patients need to look closely at their faces each day. This helps ensure that the numb area of the face is not infected or injured. There are other risks related to the specific procedures. Injecting alcohol around the nerve could lead to skin damage from scratching the injection area. This is usually of no consequence and improves on its own. However, sometimes plastic surgery is needed due to severe scarring. When the needle is used to either destroy or compress the nerve through the small hole in the skull, the needle itself could cause bleeding inside or around the brain. This kind of bleeding could be fatal and may require another operation to remove the blood clot. The needle could very rarely also injure other nerves in the area, such as the nerves responsible for vision or movement of the eye. This could, in extremely rare cases, result in blindness or double vision.
The microvascular decompression operation done through the back of the head could also result in the injury of the hearing nerve, resulting in deafness. This is not likely, but possible. For that reason, it is important to let your surgeon know if you have had any trouble hearing, especially with the opposite ear. If your only hearing ear is on the side of the trigeminal neuralgia, complete deafness may result from the operation and you may want to proceed with another surgical option. Injury to the nerve that controls the face could also occur and lead to paralysis of the face. Patients may not be able to shut the eye completely and may have drooping of the mouth. This could be permanent or temporary.
Fluid may also leak from the incision. This may require another operation to fix the leak.
Blood clots in the brain could also occur and could be life-threatening, requiring another operation. Death and strokes resulting in permanent paralysis are very unlikely, but possible. After the surgery. Depending on which operation is done, you may either go home the same day or a few days later.
If you undergo microvascular decompression, you will probably spend some time in the intensive care unit. This allows the nurses to better monitor your vital signs and neurological status. They will ask you repeatedly to move your face, arms, and legs. They will also ask you questions to see if you are thinking clearly. CAT scans of the head may be done to make sure there are no blood clots in your brain.
After the surgery, you will probably still be on your trigeminal neuralgia medication. You will be weaned off them over time, again depending on which operation was done. It may take a few days to a week to know whether the operation was successful. You should refrain from any heavy lifting or bending until your follow-up visit. At that time, your surgeon will decide whether or not you can return to your usual activities.
You should also make sure to call your healthcare provider if you develop any severe headache, fever, vision problems, or fluid leakage from the incision. All of these may be signs of serious complications.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Trigeminal neuralgia can cause severe pain or extreme numbness, tingling, or burning on a part of your face.
Trigeminal neuralgia is best treated medically. When medications fail, surgical options may be considered.
Some surgical interventions aim at destroying the part of the nerve causing the pain. These are known as ablative surgeries. Other interventions aim at taking the pressure off the ganglion. These are known as decompressive surgeries. The choice of the operation depends on the patient's age, medical condition, and expectations, as well as the surgeon's advice.
Surgical procedures are usually successful in alleviating the pain and improving the patient's symptoms. These procedures are safe. Risks and complications are rare. Knowing about them will help you detect and treat them early.
Thank you for using Explain.